Hi, you're listening to Quality Talk. I'm your host, Jody Jackson Jr. Quality Talk is a podcast from Primaris Healthcare Business Solutions. And Quality Talk focuses on healthcare quality improvement with an emphasis on the value-based care landscape and the reimbursement demands facing health systems, practices, and clinicians. This is the second of 5 Quality Talk episodes that looks at the American Heart Association's Get With the Guidelines program and registry. Let's talk about the value that Get With the Guidelines Stroke and the Joint Commission's comprehensive stroke registries, the value that those bring to hospitals. The title of our blog that focused on this particular topic was Valuable for Hospitals, Priceless for Patients. I know that one of the typical complaints and observations from clinicians these days and all of the healthcare profession staff is that seems to be less and less time to have actual face time with patients because of all of the documentation and data entry that is now required of our healthcare professionals. So that's why we like to do the reminder that this is priceless for patients, because we know that it's not a reminder necessarily, but it's an agreement, an understanding that ultimately the patients are the ones who benefit the most from improved quality care, improved health care. You know, since 2003, more than 2,000 hospitals have entered more than 5 million patient records in the Get With the Guidelines Stroke database. It's a must-have addition of recognition and research-driven treatment that Joint Commission accredited stroke centers should seek as an endorsement of quality that is meaningful to both patients and hospitals. And while not all certified stroke centers are also part of the Get With the Guidelines Stroke program, many are. And that comprises a mix of stroke centers and other acute care hospitals in small and large, urban and rural settings all across the country. And the accumulating body of research makes it increasingly clear that high performance with Get With the Guidelines stroke measures equates to better patient care, which for stroke patients means treatment that beats the clock, and the clock begins ticking the moment a stroke occurs. Now, Get With the Guidelines Stroke, just sort of as an aside or a footnote here, has also been awarded and recognized to hospitals in other countries. I believe most recently Brazil in South America. So certainly Get With the Guidelines has a global reach. As far as equating to better care and proving better care, we know this from the studies that the American Heart Association makes available to participants who in the Get With the Guidelines Stroke program. Now, it's also important to note that major insurers, this is important, major insurers take Get With the Guidelines Stroke participation into account and look at the data to determine or to adjust risk. From that point of view, that's simple, isn't it? Hospitals and stroke centers that have qualitatively shown they provide the best care are also going to get better reimbursement rates from payers. There's also tangible value in, we've already talked about the public reputation boost that hospitals can achieve through this, the Get With the Guidelines Stroke Awards and recognition. Hospitals can take advantage of those distinctions when it comes to the important task of competing for and recruiting physicians. Now, there's a vital connection. Insurance companies like to work with hospitals that have better outcomes, and so do physicians. Think about that. Your standing with Get With the Guidelines, recognition you would get from Get With the Guidelines, those are pluses for the payers and pluses for the physicians that you want to come work at your facility. So here's a little bit more about Get With the Guidelines recognition. Achievement awards, that are part of Get With the Guidelines Stroke recognition include Silver Plus and the Gold Plus Quality Awards. Those are advanced levels of recognition that recognize hospitals for consistent compliance with quality measures that are part of the patient management tool. Episode 1 of this series on Get With the Guidelines mentioned the patient management tool. You can read more about that in the show notes, in the links for this episode on the website, on the Primaris website, which is www.primaris.org. And you can also find eligibility information there for the Silver Plus and the Gold Plus Quality Award. Now, in order to further improve stroke care, the Get With the Guidelines Stroke program expanded its recognition program by creating the Plus Awards in 2009. And here's a little bit about that. The new program provides an extra incentive. It recognizes hospitals that meet 75% of compliance on any 4 additional quality measures that can include dysphasia screening, stroke education, consideration of rehabilitation, door to TPA time within 1 hour, documentation of LDL cholesterol, intensive statin therapy, and last known well. And that last known well, according to our quality data services team and data abstractors, that's one of the more difficult measures because, for one thing, it's not always documented. Did the EMS provider or the caregiver, the family member, whoever got to the person with the stroke and got them to the hospital, how accurate is their recollection of those sorts of times? And it's important that those things are documented. It's really almost a little too easy maybe sometimes to hear a time that's given to you, and then if you don't write it down right away, or if you don't enter it in the right place, then it becomes a missing piece of data, and that makes the whole process even more complicated, and it slows it down. Now, for another example of how the metrics and data abstraction and reporting ultimately leads to quality improvement, consider dysphasia, which is a common problem for patients after an acute stroke. That can lead to hospital-acquired pneumonia, and that increases morbidity and mortality. Research has shown that the use of emergency department dysphagia screen was associated with a significant reduction in the rates of hospital-acquired pneumonia, HAP, in stroke patients. So there is that's one example of an innovation and an improvement that came about as a result of the Get With the Guidelines Stroke Registry and research. As an addition, the Plus Awards recognize hospitals that demonstrate at least 86% compliance in each of the 7 Get With the Guidelines Stroke Achievement tiers. And the tier levels are determined by the length of demonstrated performance. So here's just a quick bullet point list. To qualify for an achievement award, a hospital must, 1, achieve participating Get With the Guidelines Stroke Hospital status. Number 2, demonstrate and document compliance in the 7 Get With the Guidelines Stroke Achievement measures in at least 85% of all eligible patients. And number 3, complete application for the Bronze, Silver, or Gold awards. Again, you can find links to this process and more information on our website and the show notes for this episode. So here's where the award recognition is especially good news for stroke patients. Hospitals that receive the awards have better performance on achievement measures and had superior performance on quality measures. That's what studies have shown, that those hospitals provided higher quality care even beyond the period of time that they were providing for the data. So in other words, the excellence in quality improvement and advancing quality care, those advancements and those achievements continue because it becomes part of how stroke centers and hospitals do business. And it isn't that nice to see now that the evidence that there's a higher level of care continuing even after the achievement awards and public recognition has come. That's all for this episode of Quality Talk. Thanks for joining me. I'm Jody Jackson Jr., your host. I encourage you to send your comments, questions, and suggestions for future episodes to me at jjackson@primaris.org. And to repeat, you can find the show notes for this episode with links to citations and other resources at www.primaris.org. That's all for now, and thanks again for listening. And remember, Primaris takes care of your data so you can take care of what matters most, your patients.